Minutes for questions.
Thank you, Chair Guffrey, and thank the witnesses for testifying before this subcommittee. I'm actually very grateful that we're discussing these bills, and I'm pleased to see the committee considering, as you just heard from Representative Trahan, the Accelerating Kids Access to Care Act, which would streamline administrative processes for providers who enroll in another state's Medicaid program due to a lack of services provided in the patient's home state. I'm also proud to have a fellow Iowan and constituent, Dr. Alex Basuk. I too was on faculty at the University of Iowa, go Hawks, here before the committee today. There is currently no standardized federal pathway for this process, meaning that providers must enroll in a new state's Medicaid program whenever they see a new patient from that state and must maintain regular paperwork to remain enrolled in each state's Medicaid program. And especially in Iowa, with our 4 borders, we have many people from different states who seek care in our home state. When a child from a new state is visiting a doctor, as may be the case if a child from another state travels to Iowa for care, which is not unusual at all, there are often delays in care as the providers sift through weeks of paperwork, risking the health of children with critical life-saving conditions. Mr. Chairman, I ask for unanimous consent to insert letters of support from the Leukemia and Lymphoma Society, which is undersigned by 215 organizations, and from Patients Rising for Accelerating Kids Access to Care, and from Patients Senate in support of...
If you submit those, we'll add to the documents list and take action at the end of the hearing.
One case that clearly speaks to the need for this bill involves an 11-year-old from another Midwest state who has a very rare and serious condition known as mid-aortic syndrome, in which the aorta narrows, leading to multiple serious complications that can result in death if untreated. In this case, a referral was made from another children's hospital to Boston Children's Hospital, which operates a leading program to address this condition, and a comprehensive care plan was assembled in April of 2022. In the case of the child's home state, all providers at Boston Children needed to be enrolled in the home state's Medicaid program before the state would authorize the care. By July of 2022, the enrollments were still pending 3 months later, which led to a cancellation of care that had been scheduled for the following month, August 2022. The home state did not complete its enrollment of the Boston Children's providers until November of 2022. In early 2023, Boston Children's assessed the child, and a comprehensive care plan that included additional providers given the child's specific condition was assembled. A request for authorization was submitted in May of 2023, and the care was ultimately provided in September of 2023, nearly a year and a half after the initial contact had occurred, and the child could easily have deceased before that time. Dr. Basuk, and I know you've answered some of this, in your capacity as a physician-in-chief at the University of Iowa Stead Family Children's Hospital, have you seen the administrative burden and delays with providers enrolling in other states' Medicaid programs that impact pediatric care? And can you highlight specific barriers doctors currently face in this process? I think you have, so I'm going to skip over that and said, does this legislation allow or require out-of-state Medicaid programs to cover services not covered by the patient's home state?
All right, so I'll answer that second question. No, it absolutely doesn't require the home state to cover services that they don't cover. That's not what the bill is about at all. It's about making access easier for kids with medically complex and rare diseases.
And very importantly, similarly, would this legislation lead to an increase in services provided, or rather the same services provided, but in a timelier manner?
Absolutely. It's about getting the right service in a timely manner, not different services.
And then lastly, very important, as we are looking at CBO scores, do care delays increase cost to the healthcare system?
You know, in pediatrics, we say, pay me now or pay me more later. So, yes.
Thank you. Pay me now or pay me more later. Dr. Chin, the Orphan Cures Act, which is, again, the same moniker, pay me now or pay me later, which I proudly co-sponsor, fixes the exemption from Medicare drug price negotiation to include treatments that are effective against more than one rare disease. And in contrast to my colleagues, whatever research and innovation goes on, regardless of age group, can be transferred to another age group. All of that foundation of knowledge and science and innovation is transferable, which also means that research that's done to develop one drug to treat one disease may in fact find out that it treats another disease or a side effect that we didn't even realize. So why is this legislation important for ensuring we continue to make progress in developing treatments and cures for more than 90% of rare disease patients that do not have FDA-approved therapies.
So you want to take into account all of the potential indications a drug has a viability for, and some of those may be rare diseases, some of those might not be, and the bottom line is the entire pipeline matters.
And Ms. Davis, I had a question for you, but my time has run out. It's on small molecule medicines. Thank you so much for being here, and the impact of the IRA on research and development. I'd like to submit the question to be answered.
Absolutely. Thank you. Thank you, Dr.
Thank you. I
Miller-Meeks.
yield back.
The gentlelady yields back, and the chair recognizes